1.1 Root causes of diagnostic error in studies. Error category examples. No fault, unusual presentation of a disease. Missing information. System error, inadequate diagnostic support. Results not available, error-prone processes, poor supervision of inexperienced staff, poor team communication. Human cognitive error, inadequate data gathering. Errors in reasoning. Adapted from Graeber M., Gordon R., Franklin N. Reducing diagnostic errors in medicine. What is the goal? Acad Med 2002, 77, 981-992. 1.2 Reasons for errors in clinical reasoning. Source of error examples. Knowledge gaps, telling a patient she cannot have biliary colic because she has had her gallbladder removed. Gallstones can form in the bile ducts in patients who have had a cholecystectomy. Misinterpretation of diagnostic tests. Deciding a patient has not had a stroke because his brain scan is normal. Computed tomography and even magnetic resonance imaging, especially when performed early, may not identify an infarct. Cognitive biases, accepting a diagnosis handed over to you without question, the framing effect, instead of asking yourself, what is the evidence that supports this diagnosis? Fig. 1.1 Elements of clinical reasoning. Change in probability of disease. 10. Infinity. 0. 5. 2. 1. 0.5. 0.2. 0.1. Plus 45%. Plus 30%. Plus 15%. Koenig's sign, Brudzinski's sign, nuchal rigidity. Increase probability. LR, decrease probability. 15%. 30%. 45%. Fig. 1.2 Likelihood ratio, LR, of Koenig's sign, Brudzinski's sign, and nuchal rigidity in the clinical diagnosis of meningitis. LRs are also used for diagnostic tests. Here a physical examination NDING can be considered a diagnostic test. Data from Thomas K., Hasbin R., Jekyll J., et al. The diagnostic accuracy of Koenig's sign, Brudzinski's sign, and nuchal rigidity in adults with suspected meningitis. Clin Infect Dis 2002, 35, 46-52. LR equals probability of finding in patients with disease. Probability of finding in patients without disease. 1.3 Examples of factors other than disease that influence test results. Factor examples. Age, creatinine is lower in old age due to relatively lower muscle mass. An older person can have a significantly reduced eGFR with a normal creatinine. Ethnicity, healthy people of African ancestry have lower white cell counts. Pregnancy, several tests are affected by late pregnancy due to the effects of a growing fetus, including reduced urea and creatinine, hemodilution, iron deficiency, anemia, increased demand, increased alkaline phosphatase produced by the placenta, raised D-dimer, physiological changes in the coagulation system, mild respiratory alkalosis, physiological maternal hyperventilation, ECG changes, tachycardia, left axis deviation. Sex, males and females have different reference ranges for many tests, e.g. hemoglobin. Spurious, in vitro, results, a spurious high potassium is seen in hemolysis and in thrombocytosis, pseudohyperkalemia. ECG equals electrocardiogram. eGFR equals estimated glomerular LT ration rate, a better estimate of renal function than creatinine. Problem 1.4 Sensitivity and specificity. Disease, no disease. Positive test A, true positive, B, false positive. Negative test C, false negative, D, true negative. Sensitivity equals A plus C, times 100. Specificity equals D plus B, times 100. 1.0, 0.8, 0.6, 0.4, 0.2, 0.01.00.8, 0.6. Specificity 0.4, 0.20. Sensitivity. Fig. 1.4 Receiver operating characteristic graph illustrating the trade-off between sensitivity and specificity for a given test. The curve is generated by adjusting the cutoff values denying normal and abnormal results, calculating the effect on sensitivity and specificity, and then plotting these against each other. The closer the curve lies to the top left-hand corner, the more useful the test. The red line illustrates a test with useful discriminant value and the green line illustrates a less useful, poorly discriminant test.